Welcome, welcome. Welcome to my new system of Fun, Learn and Earn. I'm Dr. R.K. Dua. I am a founder of this system, Fun, Learn and Earn. So, we have already discussed the various types of shock. We have covered the hypovolemic shock, we have covered the septic shock, and the neurogenic shock. So, now we have to discuss and cover the cardiac shock. As the name suggests, the cardiac is or heart is the main cause of shock in this case. So, as we know, without heart, nobody can survive because heart is the main pumping station that pumps the blood from heart to the various parts of the body. And the movement of the blood into the circulation is mainly because of the contracting heart. If this heart stops contracting, the blood circulation will keep on falling. 1. If the heart is contracting but the valvular system is not there, whatever the blood is pumped out by the heart, 50%, 60%, 70% is coming back into the heart. That is regurgitation. If the opening through which the blood is pumped out is narrowed, that means whatever the heart pushes the blood, the adequate amount of blood will not be pushed into the vascular system. Or if the contractibility of the heart is affected, that means heart contracts like this much, like this much. If heart is like this, it is just like a flickering, no actual contraction like this, it is just flickering. So, how much contraction of the heart? Just very slight. So that means very low amount of blood will be pushed by the heart into the circulation. So there will be no movement, there will be no venous return, the blood pressure will fall down. See, in all these cases, ultimately there is less amount of blood is being pumped out, or there will not be significant amount of blood being pushed from the heart into the circulation. So that is the main cause of shock in cardiac shock. Let's dive into the mind map and see what here it is. So first is the inadequate cardiac output lead on to inadequate cardiac perfusion, decreased oxygenation and impaired cellular metabolism. So cardiac causes may be intrinsic cardiac causes that are primarily by the heart. So that means primarily in these cases the heart will be affected. So there may be peripheral vasoconstriction because of any reason. So in those cases heart may not be able to push too much amount of blood. There may be tachycardia, that means heart is too frequently contracting. So when the rate of contraction increases, the strength of the contraction keeps on decreasing to maintain the rate. So that means less amount of the blood will be pushed into the circulation. So let's see what are the various causes of cardiac shock. First and the most important and the commonest reason is the myocardial infarction. What exactly is the myocardial infarction? That means ischemia of the myocardial muscles. When ischemia occurs, muscle will not be able to perform aerobic respiration, may perform anaerobic respiration, and ultimately these muscles die because of hypoxia. Second is valvular stenosis. This much opening should be there, now the opening has reduced to this. How the heart muscle will contract a significant amount of blood to push into the vascular system. So for some time heart will keep on pushing the blood through so high resistance, and ultimately there will be hypertrophy, that means enlargement of the heart, and the contractibility of the heart will be further decreased, and then there will be cardiac shock because the heart is not able to pump out the blood in a significant manner. Then the regurgitation of or rupture of the cardiac valves. Regurgitation means when the blood is pushed in a forward direction, the valves close and will not let the blood from the aorta into the heart. But when this valve becomes ruptured or there is stenosis or any other valvular problem, what happens? Whatever is the amount of the blood is pushed into the aorta, part of the blood will come back into the heart. So effective volume of the blood that is being pushed into the circulation will be very low, and that depends upon the degree of regurgitation of the blood back into the heart. Then is the ischemia. So ischemia of the heart infarction is significant. Your damage, ischemia means partial damage to the muscles. Transient ischemia occurs or slight ischemia occurs, cause damage, still the heart is significantly working. And then arrhythmias. As I have told, there is proper contraction of the muscle of the heart to push the blood. So when tachycardia occurs, it is like this. When arrhythmia occurs, it is just like flickering. So there will not be pumping of the blood, and when the blood is not pumped from the heart, there will be stasis of the blood in the cardiac chambers, and whenever there is stasis of the blood starts clotting. So that clot or thrombus may form in the atrium or the ventricle, and when that thrombus, or you can say that clot, dislodge from the main, that bulk of the thrombus, so that may give rise to emboli into the peripheral vascular system. So depending upon where those emboli of the thrombus goes and lodge, so symptoms will depend upon that. If it goes into the brain, the part of the brain that is not being supplied by the obstructed vessels, so symptoms will arise from that part. If it go into the kidney will be effective. If it goes into the limbs, your vascular supply to the limb will be affected. Limb may go first initially cold, numbness will be there, and ultimately gangrenous changes can occur, and all depends upon how acute the occlusion of the vessel occurs. So ventricular septal defect also, there is communication between the ventricle. When this ventricle contracts, part of the blood goes into the opposite side and part go into the aorta. So that means significant or the effective contraction will not be there. If the contraction is there, that can push 100% blood into the aorta. So part of the blood is pushed into the opposite ventricle. That means 80-60% of the blood is pushed into the aorta. So that all depends upon the significance of the communication between the two ventricles. So these are the cardiac reasons. Similarly, peripheral vasoconstriction, tachycardia, jugular venous pressure in these cases will be elevated. So depending upon what cardiac cause we have discovered to be the cause of the cardiac shock, we have to give the treatment according to that. Suppose in case of myocardial infarction, we do the cardiac angiography and we find that few vessels are blocked. So we have to open the block either by the stenting. If one or two vessels is there, if more than two vessels are there, cardiac bypass surgery is required. Similarly, in case of valvular stenosis, we have to replace the valve to save the life of the patient. Regurgitation or rupture of the valves, in these also cases, depending upon the kind of rupture, we may have to replace the valve and in case of ischemia, we have to give some vasodilators so that coronary arteries remain in the dilated state, and we may have to give some other medication to the patient to save the patient from the cardiac shock. Similarly, in case of arrhythmia, we have to give the drug so that heart should contract properly. In case of ventricular septal defect, if the minor defect is there, it will not cause shock and patient may sometimes survive into the adulthood. But when significant septal defect is there and significant crossover of the blood from the one ventricle to the other, then we may have to go for surgical closure of the septal defect. Similarly, in case of peripheral vasoconstriction, we have to find what is the cause of peripheral vasoconstriction. If that constriction can be resolved by vasodilator drugs, we can give vasodilator drug to increase the vascular capacity by decreasing the vascular resistance. If tachycardia is there, that can also be managed with the drugs. So this is the cardiac shock and the treatment of the cardiac shock. Thank you very much.